Thank you, John. So if you've looked at the program, you notice that Dr. Siddiqui, who's one of the Assistant Secretaries of Education, was scheduled to present, and unfortunately he couldn't attend, but the governor's office is being ably represented by Karin Talbert Addison, who's an Assistant Secretary in the Children's Education Division, and she's going to present the governor's efforts to improve physical activity and wellness in K-12 education. Karin, thank you for pitching it.
Thank you. And again, I'm Karin Addison, and I'm the Deputy Secretary for Education and Children's Services. And I think part of what y'all have been trying to do here is connect the dots for yourselves and for other people. And that's what I try to do in the governor's office, working for both the Secretary of Health and the Secretary of Education, because we obviously want to look at children holistically. They don't just operate in a bubble in school. Things that happen at home affect them at school. And one of those issues is obviously obesity. And I love your discussion about early childhood adversity. We've really focused on the health side of things, on trauma-informed care, and looking at child welfare as, like I said, a more holistic approach. So it's great to see everybody trying to connect the dots, and people like Senator Miller, I think appreciate that when you come to their office and help them see a pattern or see a pathway or see a solution that might have multiple options or solutions. So I'm going to probably preach to the choir a little bit here, discussing some of the issues that we face around childhood obesity. But just wanted to let you know that the primary focus on addressing obesity is through the Virginia Foundation for Healthy Youth, which is under the Secretary of Health. Originally, the foundation was tasked with reducing tobacco use among youth. The General Assembly expanded their responsibilities to include addressing obesity as well. So most of what we do is based on their information. And so I'm going to share a little bit about the data collection that they're doing, because we're really making a big effort to make data-driven decisions. I know that sounds pretty logical, but sometimes we don't make decisions based on data. Senator Miller can attest to that. Not that he ever does. But so what we use is the Virginia Youth Survey, which is a CDC tool. And we've also added additional questions on the Virginia Youth Physical Activity and Nutrition Survey. So we're trying to get a broad sense of what children are eating, what they're doing, what they're not doing, how much screen time they're getting, and this is going to give us that data. As you know, there is a large prevalence of obesity. Virginia has 34.2% of adults who are overweight, which means those are these children's parents and grandparents and aunts and uncles and neighbors. The South obviously has a larger prevalence of obesity than any other part of the nation, and we are in the South. Virginia ranked number 15 in the FS and FAT report. Again, I know I'm preaching to the choir, but I want to make sure that we set the stage. We know that this is a growing problem. Childhood obesity rates have tripled, and there's a large ethnic and geographic diversity in those obesity rates. Here we have Virginia compares fairly well in terms of high school obesity rates, but not in terms of middle school obesity rates. Although when you're talking about 2 percentage points, it's not that much. And again, 1 out of 4 high school girls is considered overweight or obese, and 1 out of 3 high school boys is considered overweight or obese. 12% of middle schoolers are considered obese, and 11% of high schoolers are considered obese. And again, the regional differences are clear. Southwest and South Side Virginia have a much higher prevalence than Northern Virginia and Central Virginia. Again, healthy behaviors, things have changed. I'm a mom of 2 children. I had to laugh about the idea of the rough and tumble play, because we do that a lot in my house. But, you know, it is also very hard to cook a home-cooked meal, and it's very hard to find the time to go grocery shopping. And you do rely on fast food, and you do rely on restaurants to provide those meals for you and your children. And it is definitely a different type of lifestyle than we used to have, and we need to address that. Back to the survey, 83% of high school students did not eat the recommended amount of vegetables and fruits each day. That is something that you have to address. Even at home, we have to address these things. Physical activity, 24% of high school students met the recommended 60 minutes of physical activity a day. That means 76% did not. And again, screen time. We recommend 1 hour of screen time for children, and 77% of students reported more than 2 hours of screen time per day. Sugar sweetened beverages, another big contributor to obesity. 1 out of 7 Virginia youth consume soda at least 3 times a day, which is a lot. So, what are we doing? As was mentioned, the governor did respond to the request by the schools to veto the bill to require physical education in schools. I think schools are feeling very challenged with the amount of time they have during the day to get their instructional required courses through, and they feel like they can't do any more. I think the answer is probably somewhere in the middle. We could probably always do more. But these are some things that we are doing within the public school system to help address obesity. We do have a very robust farm-to-school program. 85.9% of school divisions are using local foods. They do procure with local farmers and farmers markets, and that has been very successful. We also, as a side note, take SNAP benefits at the farmers markets. So if you're a SNAP beneficiary, you can get local fruits and vegetables at the farmers market, which is another thing that happened under the McDonnell administration. Again, we have changed the requirements for school nutrition. That was a federal requirement. Virginia has responded. We've also gone above and beyond with our competitive foods. Virginia, we passed a law a couple of years ago to require that competitive foods meet the same guidelines as the foods that are served in the cafeteria, so that you don't have vending machines competing with the school lunches. That did not include beverages, though. And then we have the Healthy U.S. School Challenge. This is something that almost all schools participate in, and it's really a reward-based system to encourage schools who are doing well to be rewarded and be recognized. And there's also some monetary rewards for schools that do perform well. And of course, we really encourage the idea of walking to school. The Safe Routes to School is a big program. We push for that every year, and a lot of schools have become more involved in that and are recognizing the value. I know that we do have some challenges when it comes to the ability to walk safely to school, and that requires a lot more, I think, infrastructure, sidewalks and crossing guards, but those are, I think, being addressed fairly well on the local level. So, to wrap it up, we are really trying to get our baseline data under control through this survey. And I think in terms of a legislative or a policy fix to childhood obesity, we probably need to look at how we can best target our resources. And that might mean looking at some of those areas that are maybe the geographic areas that have the higher prevalence of obesity. We do like pilot projects. You know, we want to make sure it works before we do it statewide. So I think we might be looking at some things that are more regionally focused and look at efforts to reduce things in a very targeted way, reduce obesity in a very targeted way. Again, it's a challenge to recognize the health and physical activity requirements with the requirements of the schools to educate the kids and have them pass the SOLs and the standards that we have set for them by law. So I hope that you all will continue to advocate and, you know, be patient, but also be be strategic and help us think of ways that we can take us, no pun intended, but a small bite out of the apple. It's a lot easier to address these huge societal issues, I think, when you break it down into smaller parts than when you try to do the entire thing at once. So we welcome your thoughts and your suggestions, and obviously I'll be here for Q&A as well. So thank you.